Hi, Assalamualaikum warahmatullahi wabarakatuh. A very good afternoon to everybody. Thank you, CRC Shah Alam, for the invitation. So I've been tasked to leave a lecture on where do I start, as in to all the novice researcher. Where do you start? Okay, so just a little bit of introduction about myself. My name is Dr. Zuraidah. I'm a clinical epidemiologist with the Hospital Chancellor Tunku Mukris. Previously, I was with the emergency department, but currently I'm with the unit Kesihatan Awam. So let's start. All right. So just need to ask a little bit of a question. Okay. So why do we need health research? And why does a local context matter in doing health research? Because we are all different. We are of different ethnic backgrounds, of different gender, of different age group. So we are quite unique, and we are not sort of similar to some of the homogeneous population in other places. So we have to find information, or we have to find what works for us because of this unique setup. The other important aspect of why we need to do this, because in clinical research, there is this thing called evidence-based medicine. So EBM was a concept that was introduced in the 1960s. It's technically a conscientious, explicit, and judicious use of the current best evidence in helping us make the best decision for our individual patients. All right. So you can see in the diagram, it's an area where you need to take into consideration what is the best evidence available, what is our expertise in this area, and what do patients really values and their expectations. And that's when you take into all these three considerations, then it will be implemented well, as in the evidence-based medicine implemented well. It's also very important because probably some of you want to understand a bit more. So you want information about the particular topic or particular research area, or you want to improve the quality of care that you're currently delivering. And maybe also to understand what works, what doesn't work. And also probably you have identified that something is not working, and so you need this research to bridge the gap. Maybe some of you also interested in the impact of the things that you have implemented. So you want to know how much it affects your patients or influence your patients. Maybe you have access to some resources, or you've been tasked with new services and you need to manage resources well. So you need to identify what is the best way to do this. Probably some of you in joining the academia, or you just started your scholarly journeys, you probably be more interested in discovering new areas of knowledge, or discovering new ways of using existing information or knowledge, and providing solutions to current identified problems that you have come across. At the core of it all is also a social and moral contract between us, the healthcare practitioner, and our patients. So it's something that we kind of need to do to improve the services, to improve the provision of care, to improve whatever that we're doing. Because there's no point of doing the same thing all over again if it's not working. It's provenance of the knowledge or the information that's there. So understanding that our work is built on the previous existing knowledges is very important when you're doing research. It's also ethical responsibility that attached when you're doing research, because the philosophy behind it is always in health, is do no harm. So it would that also apply in clinical research. So we first and foremost, we do no harm to our patients. So before you actually start on your journey, you probably need to do a little bit of homework and prepare yourself. So if you're thinking about doing research and you have never done it, I would advise you to get to know a little bit about the regulatory bodies that is going to be managing all things related to research. So you need to understand a little bit about if you're working in a KKM, about NMRR, its function, what does it do, how do you get information, how do you assess the information. In some universities, you got to know what is the function of the institutional review board of the organization, for example. How do you access the information? Where is it situated? What is it all about? What are things under its jurisdiction, for example? And you also need to be understanding whether are you doing a human related research work, or is it going to be animal related research work? And that is depending on your research areas in your research work. You need to be familiarized with either one of these ethics committee. And if you're into the drug trials, you need to also familiarize with the National Pharmaceutical Regulatory Agency, NPRA in Malaysia, and in terms of the regulatory requirements that will be needed. Okay, so probably one of the best way to actually get some introduction into this organization or information in relation to this is actually by getting your GCP done. So there's a lot of GCP's courses that's being organized by either the CRCs or the teaching universities. So sign up for one and make sure if it's possible to have it before you actually embark on your scholarly journey. But if you did do it, that's fine. But if you're planning to be a primary investigator and a researcher or a supervisor for that matter, I would strongly encourage you to do it. So first step is actually to choose the topic. What is your interest? What do you like? Or what is your passion? What makes you tick? What actually is your preference in terms of the field area that you're currently in? You also need to sort of envision yourself whether will this be the area that you're going to be in for the next 10 years, or are you going to be an expert area in this area? So you got to to sort of envision this as you need to be passionate and driven. And when you are into research work, you're going to be doing a lot of reading. So it's always a bonus if you are, it's not just a bonus, it's actually almost a requirement, a compulsory requirement that you need to be passionate enough in the area. You have an interest in this area so that you'll be able to be driven, and you'll be able to read all the things, all the materials, all the required readings. Because I find from my experience of teaching postgraduate students and even undergraduate students for that matter, that if you're not interested in the area that you're planning to do your research, you'll not have the drive to read. It's going to be such a grind for you. It's going to be such a work for you that it's not going to be something that you're passionate about. So that is very important in that sense lah. So I find students who are passionate about a certain area, for example, trauma, or if they're passionate about pre-hospital care, they're usually driven. So they'll do the required reading and they'll ask the right questions, and they'll be driven to even do more than what is required in terms of the learning and the reading. You also need to think within the topic area that you're interested in, who will support you. So my advice for novice researcher, research works easier to do it together in collaboration with somebody else. So try to actually find a mentor. You probably need to have more than one mentor. So usually in a clinical setting, you will have one expert content expert that would know quite thorough, the field area and all the things, the latest advancement, treatment and management and whatnot. But you may also need somebody who's familiar enough in terms of the research process, all the things related to submission to NMRR, somebody who can guide you in terms of refining your research question, your research objective, somebody can give you input about, find the best research design to answer your research question, somebody who can advise you about the most efficient way of managing your data. So you got to identify who is that person. So you got to get some sort of a balance. So there will be no one perfect supervisor or mentor. So you have to sometimes complement them. So, and it's okay to have one supervisor who's very knowledgeable about the clinical areas, but not so familiar about the research. It's okay, you can find somebody who can mentor you or assist you in that sense and complement that role. You can also access the supports that's being provided by the CRC in your local hospitals. Obviously, within the CRC itself, they have a network of personnel with different expertise level. So you can tap into that as well if, if you don't have access or you don't have a mentor that is easily accessible to you. So once you have identified the topic or the research area that you're interested in, then you probably have to ask this question. You have to ask, what is the purpose you're trying to do this research work? So is it a part of your requirement when you're doing your MSCs or your PhDs, or is it something to it's a problem that you need to find a solution for a problem at your workplace. So you need to ask this question. So if it's a problem, you need to do you need to understand this particular issue for you to fix the problem? But when you want to do this, you have to make sure that you understand the basic dimension of your problem enough, as in what's the epidemiology related to this particular problem. For example, if you're looking at, let's say, schizophrenia or stroke for that matter, what is the burden of this disease in our local context, for example? And then maybe from there also to have some idea where is the cutting edge or the new frontiers for this knowledge. It's just good to know, to see whether is it already there or is it still not being identified. Okay. So once you have set the purpose and understand it well, then you need to set the aims of your research work. So you understood there is a problem, and then now you're trying to word what you're trying to do. So what you're trying to do, you have to have it in as clear as possible. It has to be achievable, and obviously it has to be ethical as well. So you start to try and put it in your own words. So sometimes with a research aim, because it's more general, examples here are probably a little bit more specific, but it can be general just to assess the implementation, for example, of management in the prevention of for example, or just to describe the journey of cancer patient in our public health system, for example. So usually the aims is general. So for a start, it's okay. Just get it general first, because usually after we have sort of come up with the research or the study aims, then we will refine it into the research questions or the research objectives. All right. For some people, this is probably a little bit difficult, as in, like, I want to do research, but I'm not so sure about what I want to do. Okay. So, in clinical research, usually either we actually commence or embark on research work to address a certain issue, a problem, quite specifically, or aligning our research work with health research priorities, for example. So one the way for you to go about and do this is actually by looking at documents that has been published, that is, documents or policies to align our research work in nationally lah. So there's this document called Strategic Framework of the Medical Program by MOH. That's for the year 2021 to 2025. So it has few areas that is trying to focus on non-communicable diseases, communicable diseases. So this is in general. But if you zoom into each parts of the document, it actually tells you exactly what the ministry is trying to do. So this is actually close about things that you can focus on, and especially if they are aligned to your interest area or you're passionate about it. Okay, so this is some example, as in the document, it's mentioned that they want to look at improve response time to emergency situation, pre-hospital care and ambulance services, for example. So that is something that may trigger you or give you ideas to work on, okay? There's also very specific information that is being highlighted, that is that they require, or the government, the policymaker require, such as this information. So you can actually sort of have a look whether any of this actually align with you, and see whether you'll be able to start doing something within this area. There's also another document that may help for those who doesn't quite have any topics or any specific research aim or questions. Health research priority for the 12th Malaysian Plan is also a good document, and the document actually have research domain based on research domain. So there's research priorities identified within the mental health area. There's research priorities that identified within environment and disaster risk area. So it's actually quite a lot and quite varied that you can sort of focus on. And it's not just that, they also have they actually rank all these research focus area. For example, disaster and health risk in man-made disaster. And then they sort of tease it and refine it, and then they want to be looking at preparedness and response in man-made disaster. So in terms of the healthcare and community resilient, risk communication and whatnot. And as you can see on the rightmost column, they actually, like, the the authors actually rank the research priority area. So you know that number 5 is really, really important and it's really needed. So maybe if it aligns with your interest area, that's a good place to start. So this is an example that is relevant to ED. So the document actually highlighted the needs and the gaps that's available, that's currently available. So that's where your problem statement is or your gaps are, and the focus area that is needed and the expected output. So there's a lot of information that's provided here. Not necessarily that your research work is going to be very specific, but it sort of give you some clues about where to focus, what are the scope area that you can go in and whatnot lah. Okay. Okay. So once you have identified all that, then you maybe need to ask a further question as in, who is the population of your interest? Which is the population that you want to make inference to, as in this is the population that the finding of your study that you want to make an inference to. Do you have access to the population? Do you have access sample of the population? So this is very important because you want to identify who to be included in your study, and usually we call it inclusion criteria lah. So are you interested in looking at whether adult population, or are you looking at pediatric population? Are you looking at chronic kidney disease patients? Are you looking at outpatients, or are you looking at community dwelling patients? Where specifically are these patients and who are they? Okay, and then from here you also need to identify who are the ones that you not going to include in your study, so that it's not gonna actually affect in terms of the inferences or the outcome. So you may want to make it quite specific that you just want to look at type 2 diabetes mellitus, and you don't want type 1 diabetes mellitus, for example. You probably want somebody that's type 2 diabetes mellitus that is dwelling in the community, not somebody who's dwelling in a nursing home, for example. So it all has to depends on your initial aim, but you have to make sure that the initial aim sort of tie in with this population. Okay, so remember, your finding will be able to infer to this population. So also think about whether are you going to be able to sample this population? Do you have a sampling frame? How are you going to go about and do it if you need to do sampling on this population? So that might be a bit technical, but just think about whether do you have access to the names of the patient who attended the clinics, or do you have how do you going to go about and get the name or the identity or access to the population that is, your population or your patient or sample population in the communities, for example. How are you going to go about and do it? So think a little bit about that, because that will help prepare you to ask the exact question that you're not clear about, question for additional clarification when you actually seek support from the CRC personnel. So think a little bit about that. Next is you need to define what you want to know, okay? Or if in the instance that you going to do some intervention, what exactly you want to do. So you have to know the data, the variables that you're going to be collecting. If you're doing it in population, what are the parameters that you're interested in? So are you looking at the mean measurement of a certain mean measurement of, let's say, systolic blood pressure, or are you looking at the level of a certain blood pressure. So, for example, mean systolic blood pressure versus systolic blood pressure that has been categorized as in less than 130 millimeter mercury or above 140 millimeter mercury, for example, something like that. What exactly you want to know as in the differences or the specifics. Are you interested in the practice of the healthcare practitioner, or are you looking at in terms of performance of them? Are you looking at compliance? So you have to be quite clear about what exactly that you want to look at. Okay. Are you interested in whether the patient just have some idea about what the disease is, or you want them to be having more than just awareness. You want them to have the knowledge. So you got to really be clear about this, because this is what's going to be guiding your the research design, and also for you to be going back and refining your research question, and all the research procedures is going to be all related to all the things that you define here. Okay. And for those who are actually interested in doing intervention, what exactly that you're trying to do? Okay, so this has to be quite clear in the context of clinical research. Sometimes that will require you to have comparison between two groups. So this is usually the situation when you're trying to see whether something is better than the other. So usually when you were trying to say something is better than the other, you'll have to compare. So you got to think about, okay, do I have these two groups? I'm gonna try and give what I'm interested in, or the intervention I'm interested in one group, and then the other is going to just go about and do as what we're doing now, for example. So this is the best way to go about and do this kind of thing. But obviously this is the ideal. But if there is limitation in this in the way that this is going to be executed, then you may need to talk to the CRC personnel to see what are the ways for you to achieve the aim, or what you intended to do. Okay. Next is you need to identify the outcome of interest. So if you are doing the intervention, what is the endpoint of interest to you? Are you looking at improvement in the systolic blood pressure, or are you as in the improvement in the control of the blood pressure, or are you looking at reduction in the blood pressure? So what's the endpoint, and how are you going to go about and measure the response to the intervention? How will it be measured? Are you going to be using a tool? Are you going to be using just a reported outcome, as in whatever the participant, feedback from the participants, or based on what they recorded in the questionnaire, or what? When will it be measured? Are you looking at changes? So if you're looking at changes, you have to identify how was it at the baseline and how much it changes. So you have to at least measure at 2 time points, one at the baseline and another one after you've done something to them. So, and by whom? Who's going to do it? Are you going to get somebody to assess it? For example, your staff nurse to do it? Or you're going to be, it's a very specific thing that only clinician can do? Or does it involve another allied healthcare personnel that that will be able to do a proper assessment? So you need to think a little bit about that as well. And if you're using a tool to measure the outcomes, what is the level of accuracy that you're expecting? In the clinical context, sometimes you have to look at the how accurate it's a predictive score, for example, or sometimes you have to take into consideration the scoring and the period that it's covered. An example of this is, let's say, if you're looking at the HbA1c control. So we would know that it will be a HbA1c measurement will be reflective of the prior 3 months period. So 3 months period from the date that the data collection, for example. So you got to think about it, okay? In terms of the use of scoring tools, you got to understand how valid is that tool to measure whatever that you are measuring. So usually in this instance, we will talk about the validity and the reliability of the measuring tools. This can be quite technical, but if you are familiar enough in the area, for example, if you're a physiotherapist, you would know some of the tools that are commonly used in the clinical context. And usually tools that are used in the clinical context are pretty much has gone through the process of ensuring its validity and reliability lah. Okay. How will the information be recorded? Are you going to be putting into a database? Are you going to be recording it in a paper form? Are you going to be using a Google form to facilitate the data management? So you got to think about that. And where will it be stored? If it's going to be a paper form, where will it be stored for it to be secure and safe? If it's going to be in soft form, as in e-forms, where, what, whose cloud, how, who have access to the cloud, the drive, whatnot. So it can be quite detailed. Okay. But besides just identifying the variables or the parameter of interest, the outcome that you of interest that you want to know about, you also sometimes to have to anticipate, is there any other factors or other things that we call confounding that may influence the outcome atau distort the effect of the intervention? So confounding variables that may be related to the outcome of the study or the intervention itself. So you got to identify this. Why? Because anticipating the effect of a confounding factor or factor that can kacau the outcome of your study, if you identify it earlier, you can include it as an independent variable. And that is important to for you to make sense of your study later on, to really possibly adjust for the confounding factors, or just to help you interpret the finding later on. So once you have done a little bit of that, then start to think about whether, all right, is it going to be an interventional study? If you are going to be doing something, as in introducing an intervention, or is it just going to be an observational, as in the researcher is not going to be involved actively doing anything, but just observing and collecting data? Okay. Are you going to be doing it retrospectively, or are you going to be doing it prospectively? So retrospectively is just looking from data in the medical records, data that has already been collected, for example, or prospectively is usually you're doing it going forward, as in real time, and then collecting it progressively over time. Or maybe is going to be primary research, as in you're going to be collecting new information using surveys, using new cohorts that's going to be established. or you're going to be tapping into information that's already in existence, as in the secondary data. So there's a lot of registries in Malaysia, and probably you have some information of on the outcomes that you want to merge with the registry, for example. So have a think about what you want to do. But also take into consideration how much time that you have. This is very important because if you are on your scholarly journey for master, PhD, there is a limit. You have time limit because you need to graduate. You have a time limit because usually we will have to assess you by each semester. So you got to be really clear about this. So if you are an independent researcher, that's a little bit different. You may have more time, but it's always a good idea to have sort of a clear timeline in your head, as in how long you're going to be spending your energy and time in doing this particular project. Okay, so usually in the context of doing a research work, independent researcher, yeah, I'm not talking about industry-sponsored research. It probably require from 3 to 6 months for you to come up with a proposal. All right. And then once that proposal is ready, you may have a couple of months to refine it and then get it sort of up to a level that you're happy enough to submit it to the ethics committee. All right. So ethics application can go up to 3 months or more, can be from 3 months or more. Then once you actually get the ethics application, you need to sort of put aside how long you want to be doing the data collection for, some time for you to actually be cleaning the data, and also analysis of the data. Okay, so the data collection, if it's primary, as in it's a new research work, it's probably going to take longer compared to if you are assessing a secondary data. So because secondary data is usually already there, but you need to have access to it and clean it. Okay, so cleaning of primary and secondary data can be sort of the same period. And even secondary data sometimes can be quite challenging because it may be incomplete, it may be not in the way that you are familiar in terms of the organization of the data. So you may need to do some recoding, you may need to do some cleaning. So yeah, this period of time may take up 1 year or more lah. Okay. And then even after you've got you're done with your data collection and you need to do analysis and analysis for the results, and then verifying the result, and then writing about the result, that can take up to a few months. It would be good if you have somebody that is quite competent with statistical tools to actually facilitate you. So, but then sometimes if the study is actually very complex or it's actually not clear from the beginning, this period of time can be quite prolonged lah. Okay. All in all, based on my experience, it depends on the researcher. If you're driven, obviously you can do this in a shorter period of time, or at least according to schedule. Sometimes, despite your best intention to actually schedule it out, you may not achieve it according to the timeline as you have anticipated, and that's okay, that's fine, because sometimes there are things out of your control anyway. But it's always a good idea for any researcher starting on a research work or research project to have sort of this timeline clearly outlined in the research proposal itself. Okay. Obviously, there's a lot of other factors that you need to take into consideration, but I would say good work can be done within 3 years period, depending on the availability of the data, depending on your team, depending on the access of to support. All right. So if you have tried to answer each of the question that as I have outlined previously, you should be able to start on your research journey. So you should have some idea about, the problem statement itself, as in why was it a problem? Why was it identified as a problem? What does it mean, as in why was it a problem on the first place? What was the burden of related to the problem? And all the related information about it. And then you would be able to construct or at least develop the aim of the research work, what you're trying to do with this research work. And then maybe or maybe not have a research question in place and research objective in place. For a novice researcher, it's okay not to get it right, but start by just putting all this information in the Word document. Have it down, write it down. That is one of the processes that you need to do to start. Okay, so the research questions and the research objective may be refined and may require a few times to refine it, and that's okay. That's just how the work is. That's just how the processes that's involved in doing research work. You should also have some idea about the population of interest or the sample population of interest, who the inclusion criteria of the population, who you want to include, who you don't want to include, and whether you'll be able to sample this population. You will also have some idea about the variables that you want to know, that you want to be collecting for you to understand and relate to the research outcome. And you'll be able to define this variable quite clearly as well. Outcome of interest and the measurement tools that you want to measure the outcome, and then be confident about whether the tools is actually truly measuring and valid to measure whatever that you're trying to measure. You also would have some idea about what are the factors that you will need to take into consideration, or your confounding factors. What possibly design that you foresee to be suitable for you to, suitable for your research work, and how all this research work are going to be completed within a certain timeline. Okay, so if you attempt to answer all those questions, you would have something written on the paper for the first discussion, or a draft for the first discussion. And this is very important. Once you actually have it written on a piece of paper or written in a Word document, then you may need to get input from your mentor. You need to get input from the CRC personnel, get input from other experts, other people who have done it, or you need to talk to somebody, because sometimes we may not be able to see the problems that is going to be associated with this study. Sometimes you will not be able to anticipate the problems, or some info or something that's not clear enough when you actually outline it on a piece of paper. Okay, so this will be valuable for your first meeting with any supervisor as well. So yeah. Most importantly, you do all that because you want to plan and start on the right foot, right footing. You want to start in the right manner for you to be able to get the right outcome, the suitable research design. And hopefully when you have done everything in the way that it's supposed to, we're gonna get a good quality study outcome or research outcome from your study project lah. Okay, because poor research equals to poor information that may be of no value to anybody. So this is a very serious consequences. It will affect clinical practice that depends on that information. It will probably affect other research work as well. If it's on something that's important, it may affect the decision on the policy in that particular area and ultimately will affect our patients lah. So just to recap, just do better research, less research, better research, and research done for the right reason. And that's truly what it is. Asking the right question, planning for planning for the research work, anticipating problem with your research work, consulting, reaching out for support to improve your research work and whatnot, and hopefully we'll get the outcome that we want. Okay, so thank you very much for listening in. If anybody have any questions, please feel free to ask me during the Q&A session. Thank you very much.